Hello, guys. Good afternoon. My name is Isaac Obinyan. I'm a herbal researcher and practitioner. This afternoon, I'll be talking to you about male impotence. That's impotence in men. When we're talking about impotence, we're talking about sexual dysfunctions. We're talking about erectile problem, inability to gain erection, inability to sustain erection, and premature ejaculation. A lot of men are going through this problem, and it's even a major reason why we have some breakups, because sex plays a very important role in relationship and marriage. So today I'm going to be talking about herbal intervention for weak erection, no erection, and premature ejaculation. We can't talk about this topic without looking at what erection is all about. What actually leads to erection? During sexual arousal, nerve messages begin to stimulate the penis. So you see, erection is about the nerves, the brain, the muscles, the blood vessels, blood. So nerve messages begin to stimulate the penis, and then impulses from the brain and local nerve causes muscles of the corpora cavernosa. Inside the penis you have muscles known as the corpora cavernosa. So it causes those muscles to relax, allowing blood to do what? To flow in and fill the open spaces inside the corpora cavernosa. Now, the blood creates pressure in the corpora cavernosa, making the penis expand and creating what we call an erection. Then the next question is, how is erection sustained? The arteries bring blood, they relax and open, so blood comes in. The veins are supposed to take blood out of the penis. They close up, preventing blood from going out. So this way, the penis is able to stay turgid throughout intercourse. Now, there are a lot of factors that may affect the ability of the penis to get erect and the ability of the penis to stay erect. Number one is alteration in nitric oxide. Number two is cyclic aminophosphates. That's alteration in levels of cyclic aminophosphate. Number three is cyclic guanosine. Number four is monophosphate pathway. If there's alteration in the monophosphate pathway, or there might be a problem with erection, gaining erection, or sustaining erection. There are also other regulatory mechanisms that may affect erection. They include the gap junction, the ionic channels, and what have you. So today we're not talking about this plant. We're going to talk about this plant. This is the plant of the moment. This plant is called Jatropha coccus. We have red Jatropha and we have white Jatropha. Now, before we talk about, we've talked about erection. We're forgetting something. We're forgetting orgasm. Because orgasm is the major problem. A woman will say, he came too early. He came in 1 minute. He's an Indomie noodle man. He's a spaghetti man. In 10 minutes he has come. In 1 minute he has come. I didn't enjoy it. So orgasm itself includes pelvic contraction and intense pleasure that men feel as they release or as they come during sexual excitement or sexual intercourse. Now, orgasm involves a lot of phases. It involves the excitement phase, the play to, the orgasm itself, the resolution, and the refraction. These are all stages in orgasm. Let's talk about ejaculation. Ejaculation itself is just about the ejection of semen out of the male body. How does ejaculation occur? Now, sexual stimulation and friction, that is the penis movement inside the vagina, or oral stimulation, or whatever stimulation, that sexual stimulation and friction provides impulses that are delivered to the spinal cord. So the impulses go from the penis to the spinal cord. Remember, we're talking about ejaculation. Why is it quick? Why is the man able to delay ejaculation? So the impulses are delivered to the spinal cord and then subsequently to the brain. So ejaculation starts from the penis to the spinal cord to the brain. So ejaculation itself is a reflex action controlled by the central nervous system. So it is triggered when the sexual act reaches a critical level of excitement. Ejaculation itself is in two phases: emission, expulsion. That's beyond the scope of this discussion today. Now, premature ejaculation is caused. Why is it that some men come too quickly? A man is supposed to be able to hold himself until the woman is satisfied. And we have women of different appetites. Some women in 5 minutes they're okay, some in 10 minutes, some in 1 hour. So a man should be able to hold himself and continue the sexual act until the woman is thoroughly satisfied. There are factors that cause premature ejaculation. Number 1 is physical factors. Number 2 is chemical factors. Number 3 is psychological or emotional factors. Number 4 is the main problem. That's the hormone-related problem. That's the hormonal problem. And it is usually related to a particular hormone in the men. We call it oxytocin. So the oxytocin level can determine whether a man is going to come quickly or whether a man is going to be able to delay his ejaculation. So now let's talk about the herb proper. I know you've been waiting to hear about Jatropha coccus. This is the magic plant. Is it that you use the red Jatropha or you use the white Jatropha? I can't find the red one around, but if you have the white one, you can also use it. Jatropha coccus is able to take care of lots of health challenges because it is loaded with several bioactive compounds. This plant is just fantastic. For instance, the leaves, stem, and roots of Jatropha coccus contains bioactive compounds like garlic acid, like ellagic acid, like beta sitosterol. Yes, it's present in Jatropha coccus. There's also quercetin present. There's coumarin present in Jatropha coccus. There's benzoic acid present in Jatropha coccus. There's salicylic acid present in Jatropha coccus. There is apigenin present. There is vitaxine present. There is isovitaxine present, all in Jatropha coccus. Then there is stigmasterol, also present as a bioactive compound inside this same Jatropha coccus. And each bioactive compound has the capacity of improving a particular aspect of a human being's health. For example, based on preparation and presentation, Jatropha is able to treat dysentery, diarrhea, is able to treat Staphylococcus aureus, this very sexually transmitted ailment that is difficult to treat. It is able to treat Staphylococcus, it's able to treat E. coli, it's able to treat it's able to fight cancer. It has been found to be able to put a brake on the growth of cancer cell. It's very, 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 very good for treatment of cancer. It's not just the Jatropha, it's the latex. You see that latex coming out? It's loaded with bioactive compounds that is able to fight cancer. It's able to treat fungal infections, it's able to treat respiratory problems, it's able to treat fever, it's able to improve blood flow, it's able to bring about what we call oxytocin balance. So the second to the last and the last examples I have given of for some of the ailments is able to treat, that is improvement of blood flow and balance of oxytocin level. Then stimulation is able to stimulate the production of nitric oxide. Nitric oxide plays a very important role. Nitric oxide is produced by almost every cell in the body, right? Now, Jatropha stimulate nitric oxide production. Nitric oxide stimulates what we call vasodilation. That is, it causes the inner muscles of the blood vessels to do what? To relax and expand, thereby increasing blood flow and lowering blood pressure. This is the advantage that Jatropha coccus has over drugs like Viagra, anafranil, and all those drugs. Those drugs would stimulate nitric oxide production, but also increase heart rate, thereby increasing blood pressure. So that's why you have a situation where some men are using Viagra and having sex, and then they collapse, they have heart attacks and die. You can't use Jatropha coccus and have heart attack because Jatropha coccus is able to do what we call vasodilation. It's able to cause your blood vessels to relax from inside, expand, and lower the blood pressure. So while you are enjoying the fun, having sex and having orgasm, you are not at risk of having heart attack or high blood pressure. So this is the plant, Jatropha coccus. And maybe we should I think I should enlighten you a little about some of the pharmacological properties of Jatropha coccus. It has antimicrobial property. It has anti-cancer property. It even has anti-HIV property. It's able to kill HIV cell. That is extract, alcohol extract of the leaf and bark of Jatropha coccus has been proved to be able to kill HIV cell. Is that not interesting? Now, this latex that I talked to you about earlier, it has strong anti-cancer property because it contains a particular alkaloid known as jatrophin. Jatrophin is spelled Jatrophiene. So it also has anti-inflammatory properties. So if you are a man and you have erectile dysfunction problem, weak erection, premature ejaculation, all you need to do is, it's not the leaves. The leaves are useful for the other things I've talked about. It's the roots, the lateral roots. Just do what we call non-destructive harvesting of the roots. Clean and just cut the tips of the roots. You wash, soak in alcohol. Take 60 ml in the morning, 60 ml at night. I'm telling you, it will correct your erectile dysfunction problem. You will have good and hard erections. You will become a hard hitter, I'm telling you, and you will be able to go for hours. I assure you, because I know this plant. It works like magic. I've used this plant in preparation of herbs for friends and relatives, and their stories have turned around for the better. So this is how to use Jatropha coccus for treatment of erectile dysfunction, weak erection, premature ejaculation, and all whatnot. Thank you very much. Have a nice day. It's bye for now.